about pterygopalatine fossa. The pterygopalatine fossa is a corner funnel-shaped paired depression here, deep to the infratemporal fossa and posterior to the maxilla on each side of the skull, located between the pterygoid process of sphenoid bone and maxillary tuberosity, close to the apex of an orbit. Placed between the infratemporal fossa laterally and the nasopharynx medially, it functions as a neurovascular conduit. It is the indented area medial to the pterygomaxillary fissure. In other words, the pterygomaxillary fissures is a kind of opening of pterygopalatine fossa leading into the sphenopalatine foramen. Here, the boundaries of pterygopalatine fossas are anteriorly the superomedial part of the infratemporal surface of maxilla. In other words, posterior wall of maxilla, and posteriorly the root of pterygoid process with adjoining anterior surface of greater wing of sphenoid and the pyramidal process of palatine bone. Sometimes the pyramidal process can be said as a floor of this fissure. This is the pyramidal process of palatine bone, and medially the perpendicular plate of palatine bone with its orbital and sphenoidal processes, and laterally no wall. If we are to say there is a pterygomaxillary fissure laterally, the opening of the pterygopalatine fossa. The main contents of this fossa are maxillary nerve, including nerve of pterygoid canal and the pterygopalatine ganglion. And finally, the terminal third of the maxillary artery. The communication of this fossa is very important and is as follows. First, posteriorly. Posteriorly, via foramen rotundum, the pterygopalatine fossa communicate with the middle cranial fossa like this. But the foramen rotundum cannot be seen well in this sagittal view. And the next, through the Vidian canal or the pterygoid canal, the foramen lacerum communicate with the pterygopalatine fossa. The pterygoid canal, which will be described shortly later, is located posterior and medial to the foramen rotundum, and I will mark like this. And through this canal, the pterygopalatine fossa communicate with the foramen lacerum and middle cranial fossa. And finally, via palatovaginal canal, the pterygopalatine fossa communicate with the nasal cavity and nasopharynx, which cannot be seen in this figure because it is located more medially. And anteriorly, via medial end of the inferior orbital fissure, the pterygopalatine fossa communicate with the orbit, and medially via sphenopalatine foramen around here, it communicate with the nasal cavity, and laterally through the pterygomaxillary fissure with the infratemporal fossa, as I described earlier in the infratemporal fossa section, and inferiorly via pterygopalatine canal, which cannot be seen well in this figure. Also, the pterygopalatine fossa communicate with the palate, in other words, the oral cavity. In this pterygopalatine fossa, there are 5 important openings. Let's write down them one by one. The first one is the foramen rotundum. The foramen rotundum is a circular hole in the sphenoid bone and is located near the roof of the pterygopalatine fossa that connects the middle cranial fossa and the pterygopalatine fossa. Here, it allows the passage of the maxillary nerve. And the second one is the pterygoid canal. It can also be called as a Vidian canal. The pterygoid canal is a passage in the sphenoid bone of the skull, leading from just anterior to the foramen lacerum in the middle cranial fossa to the pterygopalatine fossa. So, to express in a different way, the pterygoid canal runs through the medial pterygoid plate of the sphenoid bone to the back wall of the pterygopalatine fossa. As you know, it transmits the nerve of pterygoid canal, the artery of pterygoid canal, and the vein of the pterygoid canal. They can be also called as, respectively, the Vidian nerve and Vidian artery and Vidian vein. The third one, pharyngeal canal. This canal can also be called as the palato-vaginal canal. The pharyngeal canal is located between the sphenoid bone and the palatine bone that connects the nasopharynx with the pterygopalatine fossa. It transmits the pharyngeal branch of the third part of the maxillary artery. This artery should not be confused with the ascending pharyngeal artery, one of the branch of external carotid artery, and the pharyngeal nerve from the pterygopalatine ganglion, which is the branch of the maxillary nerve. An inconstant vomeropharyngeal canal may lie between the ala of the vomer and the vaginal process of the sphenoid bone, medial to the palato-vaginal canal, and lead into the anterior end of the palato-vaginal canal. One is sphenopalatine foramen. The process of the superior body of the palatine bone are separated by the sphenopalatine notch, which is converted into the sphenopalatine foramen by the undersurface of the body of the sphenoid bone. In the articulated skull, this foramen leads from the pterygopalatine fossa into the posterior part of the superior nasal meatus of the nose. This one is the pterygopalatine fossa, sphenopalatine foramen. And transmits the sphenopalatine artery and vein and the nasal branch of the maxillary nerve, including nasopalatine nerve. This foramen transmits the sphenopalatine artery and vein and nasal branch of maxillary nerve. And the final one is the pterygopalatine canal. Sometimes it is called as the greater palatine canal. The pterygopalatine canal is formed by a vertical groove on the posterior part of the maxillary surface of the palatine bone and is converted into a canal by articulation with the maxilla. Lasopalatine canals branches off from this canal, and sometimes there are two separate canals from the start. It is a passage that transmits the descending palatine artery, vein, and greater and lesser palatine nerves between the pterygopalatine fossa and the oral cavity. The greater and lesser palatine foramina open in the posterior lateral aspect of the hard palate. Some authors describe anterior and posterior compartments of the pterygopalatine fossa, where the anterior compartment contains the third part of the maxillary artery and its branches, and the posterior compartment contains the maxillary division of the trigeminal nerve and the nerve of the pterygoid canal, together with the pterygopalatine ganglion and its branches. To summarize this session, let's draw the schematic diagram of the communication of the pterygopalatine fossa. Okay. This is the line of the pterygomaxillary fissure, which meets perpendicular with the medial end of the inferior orbital fissure. So this is the inferior orbital fissure. And this lines means that the pterygomaxillary fissure and pterygomaxillary fissure is formed by the posteriorly by the pterygoid process of the sphenoid bone, which has two plates, medial and lateral plate, and the anterior line, this one is the posterior wall of maxilla. Inside and posterior to the posterior wall of maxilla, there will be a portion of the pyramidal process of palatine bone. Process of palatine bone. And this is maxillary tuberosity. And because it's a little bit complicated here, so I erase some part of the explanation like this. And in this figure, the inside the portion of this pterygomaxillary fissure is a pterygopalatine fossa. And we will talk about the communications of this fossa. Okay. And there will be a foramen in the near the roof of the pterygopalatine fossa here, and it is connected with the inside of the middle cranial fossa. This is a foramen rotundum. And through this foramen, the maxillary nerve passes, and the pterygopalatine fossa communicate with the middle cranial fossa. And another foramen located in the posterior wall of the pterygopalatine fossa is a pterygoid canal, which starts from the foramen lacerum here to the posterior wall of the pterygopalatine fossa. This is a foramen, not foramen, this is the pterygoid canal. And in the pterygopalatine fossa communicate with the foramen lacerum and middle cranial fossa. The contents of this canal is nerve, artery, and vein of pterygoid canal. And in this figure, the more medially far from your side, there will be a pharyngeal canal. Via this canal, the pterygopalatine fossa communicate with the nasopharynx and pharyngeal nerve, nerve artery pass through it. And anteriorly, there is an inferior orbital fissure, and under this fissure there is a kind of groove named as infraorbital groove and canal, and continues with the foramen, infraorbital foramen. Through this canal, the infraorbital orbital nerve, artery, and vein pass through it, and the pterygopalatine fossa communicate with the face. And there is a small foramina behind the posterior wall of maxilla. It is called as alveolar foramina. And communicate with the alveolar canal. The contents of this foramen and canal is the posterior, superior, alveolar, nerve, artery, and vein. And in the medial wall of pterygopalatine fossa, there is a sphenopalatine foramen leads into the nasal cavity, and the sphenopalatine artery and vein, and the nasal branches of maxillary nerve pass through this foramen. And finally, we have greater and lesser palatine foramina in the posterolateral side of the palate, and this foramina is continuous with this canal. This canal is pterygopalatine canal. Through this canal, descending palatine artery artery, and greater and lesser palatine nerve pass through it. It communicates with the palate, and in other words, an oral cavity. Okay, thanks for your attention.